What if the biggest health risk for young women today isn't something people usually talk about? Most people believe heart disease is a problem for older adults, especially men. But doctors and researchers are now seeing a surprising and worrying trend. More young women in their 20s and 30s are developing heart-related problems. The question is, why is this happening? And what can be done to stop it? In this video, we're going to explore an important topic that deserves far more attention. We'll talk about why heart disease is rising among young women, what's happening inside the body when heart disease develops, the early warning signs that are often overlooked, and the practical steps every woman can take to protect her heart. By the end of this video, you'll have a clear understanding of the risks, the science behind it, and simple lifestyle habits that can help keep your heart healthy for years to come. To understand this issue, it helps to first understand how the heart works and why it's so important. The heart is a powerful muscle that pumps blood throughout the body. Every second, it sends oxygen and nutrients through a network of blood vessels that reach every organ and tissue. When the heart and blood vessels are healthy, blood flows smoothly through the arteries and veins, delivering everything the body needs to function properly. However, heart disease begins when this smooth blood flow becomes disrupted. Over time, fatty substances and cholesterol can build up inside the walls of the arteries. This buildup forms what doctors call plaque. As plaque grows thicker, it narrows the arteries and makes it harder for blood to pass through. When the heart muscle doesn't receive enough oxygen-rich blood, it can lead to chest pain, weakness, or in more serious cases, a heart attack. For a long time, heart disease was seen as a condition that mostly affected older men. But newer research has revealed that young women are increasingly experiencing heart-related problems much earlier in life. This change has surprised many experts, and it highlights the importance of understanding the causes behind this trend. One major reason for the rise in heart disease among young women is the increase in certain health conditions that affect the cardiovascular system. High blood pressure, high cholesterol, and diabetes are becoming more common among younger adults. These conditions slowly damage the blood vessels and increase the risk of plaque buildup inside the arteries. High blood pressure is especially important to understand. When blood pressure stays elevated for long periods, it puts extra strain on the walls of the arteries. Over time, this pressure can weaken and damage the vessels, making it easier for plaque to accumulate. This process reduces the flow of blood to the heart and other parts of the body. Another factor contributing to the rise in heart disease is modern lifestyle habits. Many people today spend long hours sitting at desks, working on computers, or using smartphones. This lack of physical activity affects circulation and makes it easier for weight gain and metabolic problems to develop. When the body isn't moving enough, the heart doesn't get the regular exercise it needs to stay strong and efficient. Diet also plays a powerful role in heart health. Many common foods today are highly processed and contain large amounts of sugar, unhealthy fats, and salt. When these foods are eaten regularly, they can raise cholesterol levels and promote inflammation inside the body. Inflammation makes it easier for plaque to stick to artery walls, gradually narrowing the pathways that blood uses to reach the heart. Stress is another factor that cannot be ignored. Young women often face multiple responsibilities at once, including careers, education, family responsibilities, and social pressures. Chronic stress triggers the release of stress hormones in the body. Over time, these hormones can increase blood pressure and affect the balance of chemicals that protect the heart and blood vessels. One important point that many people don't realize is that heart disease can look different in women compared to men. The classic image of a heart attack usually involves severe chest pain, but women often experience different symptoms that are easier to overlook. Instead of intense chest pain, a woman might feel unusual fatigue, shortness of breath, nausea, or discomfort in areas such as the jaw, neck, back, or shoulders. These symptoms can sometimes appear gradually and may be mistaken for stress, anxiety, or Because of this, many women delay seeking medical help, which can make the situation more dangerous. Recognizing these subtle warning signs is extremely important for early detection and treatment. Another unique aspect of heart disease in women involves the smaller blood vessels that supply the heart. In some cases, the main arteries may look clear, but the smaller vessels that branch out from them may become narrowed or damaged. This condition affects blood flow to the heart muscle and can cause symptoms, even when major arteries appear normal during testing. Hormonal changes can also influence heart health. Hormones help regulate many functions in the body, including how blood vessels relax and contract. Changes in hormone levels during different stages of life can affect how the cardiovascular system responds to stress, diet, and other environmental factors. Pregnancy can also play a role in future heart health. Some women develop conditions during pregnancy, such as high blood pressure or gestational diabetes. These conditions may disappear after pregnancy, but they can increase the risk of developing heart disease later in life. For this reason, doctors encourage women who have experienced these complications to monitor their heart health carefully in the years that follow. While these risks may sound concerning, there is also encouraging news. Many of the factors that contribute to heart disease are preventable or manageable with healthy habits and regular medical care. One of the most effective ways to protect the heart is through regular physical activity. Exercise strengthens the heart muscle and improves circulation throughout the body. Activities such as brisk walking, swimming, cycling, or dancing can help maintain healthy blood pressure and cholesterol levels. Even moderate exercise performed consistently can make a significant difference over time. Nutrition is another key component of heart health. A balanced diet that includes fruits, vegetables, whole grains, lean proteins, and healthy fats supports the body's natural ability to maintain healthy blood vessels. Foods rich in fiber help reduce cholesterol levels, while healthy fats found in foods like nuts and fish support the flexibility of blood vessel walls. Reducing the intake of processed foods and sugary drinks can also help prevent weight gain and metabolic problems. Small changes in daily eating habits can gradually improve overall cardiovascular health. Sleep is often overlooked when discussing heart health, but it plays an essential role in maintaining the body's balance. During sleep, the body repairs tissues, regulates hormones, and allows the cardiovascular system to recover from daily stress. Poor sleep patterns can disrupt these processes and increase the risk of high blood pressure and other heart-related problems. Managing stress is equally important. Finding healthy ways to relax and recharge can protect both mental and physical health. Simple practices such as deep breathing, meditation, spending time outdoors, or connecting with supportive friends and family can help reduce the effects of chronic stress on the body. Regular medical checkups are another important step in preventing heart disease. Monitoring blood pressure, cholesterol levels, and blood sugar allows doctors to identify potential risks early. Early detection makes it easier to manage these conditions before they cause serious damage to the heart and blood vessels. Understanding family history can also provide valuable insights into personal risk. If close relatives have experienced heart disease at a young age, it may be wise to discuss this history with a healthcare provider. Knowing this information can help guide screening and preventive strategies. Awareness is one of the most powerful tools in protecting heart health. Many young women simply do not realize that heart disease can affect them. By learning about the risk factors, recognizing early symptoms, and making healthy lifestyle choices, it is possible to reduce the likelihood of developing serious heart problems later in life. Another important step is sharing this information with others. Conversations about heart health can encourage friends, family members, and communities to take preventive action. The more people understand about cardiovascular health, the easier it becomes to create supportive environments that promote healthy living. In many ways, heart disease develops slowly over time. The habits we form in our 20s and 30s often shape our health decades later. By making small, consistent improvements in diet, activity levels, stress management, and sleep, the body can maintain a stronger and more resilient cardiovascular system. It is also important to remember that prevention is not about perfection. No one follows a perfect lifestyle every day. What matters most is building sustainable habits that support long-term health. Even gradual changes can add up to powerful benefits for the heart. As awareness continues to grow, researchers and healthcare providers are working to better understand how heart disease affects women and how prevention strategies can be improved. This research will help guide future treatments and educational programs aimed at protecting women's cardiovascular health. In summary, heart disease rising among young women is a serious issue that deserves attention. Changes in lifestyle, increasing rates of high blood pressure and diabetes, chronic stress, and modern habits all contribute to this growing concern. At the same time, recognizing the symptoms and understanding how the disease develops can help women take control of their health earlier in life. The most important message is that heart health begins with everyday choices. Staying active, eating balanced meals, getting enough sleep, managing stress, and scheduling regular health checkups are powerful steps that can protect the heart for many years. If you found this video helpful and informative, consider supporting the channel by liking the video and subscribing for more health and educational content. And if you have thoughts or experiences related to heart health, feel free to share them in the comments. Your perspective could help others become more aware and take positive steps toward protecting their own hearts.